On the Medical Watch, investing in emergency care.
Medical reporter Dina Baird takes a closer look at a community hospital's efforts.
Many medical facilities face challenges when it comes to recruitment and retention of doctors, especially those in underserved neighborhoods. Instead of relying on third-party staffing, a local hospital took a traditional path, and it's paying off.
There's something about this hospital that people immediately take to and warm up to, and they stay forever. I was supposed to be here for 3 years. This is my 21st year.
The doors have been open since 1898. St. Anthony's stands on the city's southwest side between Little Village and Lawndale.
It's predominantly Hispanic. It's very tight-knit. These folks have been here for generations.
About 80 to 100 patients visit the Independent Hospital's emergency room each day.
We do not turn anyone away. We do have patients who are uninsured or underinsured. We do not even ask the question.
But Dr. Romeen Lavani does ask one question of prospective emergency department staff.
You're telling them up front, you're going to face these challenges. Are you ready for it? And and we are okay if they say no.
Today is my 1-year anniversary. Y respira profundo.
Dr. Monica Tolowinski said yes.
I was looking for something that would feel a little bit more meaningful, more impactful.
The emergency medicine specialist actually lives in the neighborhood.
It felt like a really natural fit for me to be doing that kind of work, especially for my neighbors, really.
Okay. ¿Ha tenido una transfusión en el pasado?
Their heart is in the right place. They want to serve the underserved, and they are willing to face the day-to-day challenges that come with that. And it's hard to get that with a third party.
While about 2/3 of hospitals outsource emergency medicine specialists, St. Anthony's administrators added 7 ER docs and several physician assistants to the staff, a move they hope will build a culture of camaraderie and compassion.
It was very hard to make a third-party team understand what we are trying to do for the community. They were professionals, they were doing a good job, but they didn't feel the need to immerse themselves completely into this mission.
It's actually our neighborhood hospital, which is great. It's literally like 2 minutes from our house, so it's just a come and go.
This is the second recent visit for Martha Cortez.
My daughter had a febrile seizure. As soon as we came in, I requested help in the front, and they immediately brought my daughter back.
Yeah, ticklish and cold, huh?
And now we're back again with my second child.
A little cold, yeah, I know.
We believe that a patient here should get the same care that they would have got on Michigan Avenue.
While the pay may not be the same, there are other perks, including help with loan repayments for medical staff.
What we can offer, the work experience, right? The experience is very gratifying, and some people want that. Most people want that.
The team has made a difference in the last year. The number of patients who left without being treated dropped from about 4.77% to less than 2%.
We've gotten really creative in terms of what we're able to do and how we can circumnavigate the challenges.
It comes down to that desire, that will to do good by your patient. That's very important. Yeah.
The hospital's patient satisfaction rating has improved since the staffing transition. The ER team says they are hopeful even more positives will come as a result. Back to you.